Right. Now, a study in the United Kingdom has found that as many as 1 in 50 people are actually getting headaches from taking painkillers. I'm joined now by the owner of Collis Pharmacy in Phibsborough, Richard Collis. Richie, welcome to the programme.
Thanks, George.
Formerly president of the pharmaceutical organisation, is that right?
Historically, yes. Long time ago.
All right, but still dishing out the painkillers up in Phibsborough. Now, what do you think about this survey that actually taking tablets to cure the headache actually gives you one?
Well, we'd only really be aware in the area of the likes of codeine-containing analgesics, which are more strictly controlled now than they would have been some years ago, whereby people would be taking codeine-containing compounds. And as the body gets used to these codeine compounds, they would metabolize them quicker, and as a consequence, people would have to take more of the same medication to get the same effect. Now, I'm not 100% sure whether that relates to what the study in Britain is about, but that would be the clearest example of rebound headaches that I would have come across in pharmacy.
All right, so there is already, though, a title for it. It's interesting that you have a title called Rebound Headaches.
The rebound, you'll find it with other medications as well. Nasal decongestants should only be taken for 3 or 4 or 5 days as a max, because you'll get this rebound effect as well, where the congestion will come back worse than ever if you persist with taking the medication. So there's something in the way the body metabolizes these medicines that creates, as best word that comes to mind, is an immunity to the effect of these medicines. And consequently, you keep on taking them to try and get the original effect. The real issue, though, George, is that over-the-counter medicines should only be taken for a short period of time to relieve an acute situation. If it becomes chronic, the person has to go to their GP to have the issue investigated.
Yeah, but Mary Harney, who wasn't a fan of pharmacists, would have, in a way, almost with deregulation and so on, make pharmacy quite a difficult profession. But when you say go to your GP, that may well cost somebody €50 they can't well afford. Isn't the whole point, though, of the trained pharmacists, such as yourself, that very often you can give this kind of help and advice? Because now, under the latest regulations, you actually have a sort of a consulting space there, don't you?
Yeah, but historically that was always the situation. We treat people who come in off the street with symptoms. You have to assess whether those symptoms are severe enough to merit a visit to the GP or not. So if someone comes in on a Monday morning with a hangover and they have a headache and have to go to work, I think giving them paracetamol is quite a safe option. It'll clear the headache, and it's probably a once-off situation. I only use that example because it's pretty clear-cut. But very often a person will come in with a persistent headache. Not very often, but will come in with a persistent headache, and you have to make a decision as to whether you give them a short-term treatment or you tell them to go to the GP. It is expensive. We all know that everything, being sick has never been cheap, but the issue really is that where there's a question mark, that question mark has to be answered, and the pharmacist is the best person in the community to direct or redirect.
Yeah, but my guest, Richie Collis, owner of Collis Pharmacy in Phibsborough. But Richie, if you go back 50 years, not all that long. I mean, you're only going back to the 1960s.
I was starting then, George.
But if you go back to the 1960s, what you had, for instance, if you take the common cold, you didn't have something that fixed the symptoms. Now you can still have the common cold, but the symptoms of runny nose and so on go away because you can get a pill for it. Isn't there ready access to over-the-counter medicines, which wouldn't have been there as long ago as 50 years ago, perhaps? Isn't that part of the problem, that people are taking too many of whatever the pill happens to be?
I think in certain circumstances that can be the case, because the regulations with regard to the sale of codeine-containing analgesics were tightened up in response to what was perceived to be a kind of hidden problem in the community, that is addiction, kind of middle-class addiction, if you like to call it that. But certainly it was used, these products would also be used by people who had a deeper-seated addiction. But in reality, the symptomatic treatment of colds hasn't changed all that much over the last number of years. It's still paracetamol and antihistamine if your eyes are running, or decongestant if you're congested upstairs.
But Richie, Florence Nightingale, if we go all the way back to the Peninsular War, more soldiers died because they were wounded rather than they were killed, if you know what I mean, because your chances of surviving being wounded was actually very low. World War I, similar, and it wasn't until World War II, and even then, penicillin, as it was then called, was fairly rare. But you now meet somebody and says, I'm on antibiotics, and because of my advanced age, I think, you're talking about something that in the 1940s would have saved men's lives and would have been seen as a miracle drug. I mean, do we not just look at antibiotics now in a very casual way? They are overprescribed very often by doctors, and we get things like MRSA in hospitals because we have bugs that are resistant to stuff that has been prescribed too often.
Well, it's human nature, George. Unfortunately, getting the balance in anything, just in medicine, it's as hard in medicine as it is anywhere else. And I suppose that's part of the reason why you have to have trained pharmacists in the community. People come in and say, can you give me antibiotics? You ask them, what are your symptoms? Well, you first tell them you can't give them antibiotics, but you ask them what their symptoms are. And very often, it's quite clear it's a viral-based cold they have, which antibiotics would be absolutely useless for. And in fact, I'm not too sure of the figure off the top of my head, but I think it's up to 70 or 80% of these complaints are just viral-induced common colds, which is treated with paracetamol, antihistamine and decongestant if necessary.
All right. Thank you so much for joining me. Richard Collis there at Collis Pharmacy in Phibsborough. So go in and talk to your pharmacist and tell him what's wrong with you, and you'll get some worthwhile advice, and it might save you 50 quid at the GP's.